Welcome to DocTalk Live. I'm Brad Goodman, and I'm with Melanie Miller, and I'm with Jules Gann. Melanie is a physician with
Birmingham Integrative Health.
And Jules is a nurse practitioner with Dr. Miller. And I prefer to call you Melanie. And Brad works for me as well. If you are seeing this live, we welcome your questions. If you are seeing this on a rebroadcast later, somehow it shows up on your feed, we love it when we get comments, criticisms, questions. I love it. Feedback is very helpful, so any feedback, and hopefully Melanie, you could get on and maybe
I shall be watching it.
Answer the questions that we haven't answered. Tell us a little bit about, before we get to the thyroid, tell us a little bit about integrative health.
Fair.
And tell us a little bit about how you practice with a nurse practitioner, how that extends you and allows you to be mom
Nice.
and doctor as well.
A little bit.
Okay.
Anyway. So I have been practicing family medicine for 15, 20 years. Time flies.
No.
I know, right? And honestly, while I was in residency, I got trained in acupuncture. I had received acupuncture for a car injury, neck injury, and I did very well. So I knew I wanted to be trained in acupuncture because if that could make me better, why wouldn't it help others? Well, when you start doing something that's outside the box, and you know that, Brad, through prolotherapy and things like that you've done in the past.
Well, I tend to do things, I tend to see patients that force me to get outside the box because they've tried all the in-the-box treatments.
Right.
So I'm very open to be out of the box.
I think that's exactly the attitude we need to have.
Okay.
So when you have that attitude, you're right. Oh, you do acupuncture, so do you do herbs? Well, then you start learning herbs. Oh, you do herbs. Do you know about bioidentical hormones? Well, let me go to a conference. Oh, you do bioidentical hormones. Do you treat adrenal fatigue? And so you know how that cascade goes. And then you start going to lovely conferences that say, look, this has helped. And you start thinking about patients. I never leave a conference without a list of initials of, oh, this patient might be exactly where I haven't filled that gap. And so I think it's one of those parts that evolves over time, and I would never want to throw away Western medicine. I think we're all trained and we understand what Western medicine has to offer us between medications and surgeries, but there are gaps. There are gaps in what we know, and we're constantly learning new things. So I think that I have a patient who says, will you read this book? And we just learn more.
So how did we get to thyroid as opposed to talk about the gaps?
I know. Well, we can always talk
Because the gaps are what fascinate me.
Well, this is probably my favorite hormone. So you asked, what could we talk about? And thyroid's probably one of my favorite hormones. I think it's a hormone that we know a lot about. We have the science behind it, but there's always an art to that thyroid hormone. There's an individual you need to treat, and they have different other backgrounds that are going on. Maybe they are going through menopause. Maybe they have some adrenal fatigue. And so you have to tailor it to what's going on with that patient. And I think that's just one of my favorites. And it's one of my favorites.
Why is thyroid one of your favorites?
Well, I probably mostly read a lot about thyroid because I have Hashimoto's as well. So I have an autoimmune thyroiditis with multinodulars, and I've kind of been through that route. Mine's still functioning, but I guess I'm waiting for it to not someday.
Okay, so let's break this down. She said, I have Hashimoto's. and that's what? Now, the antibodies of your own body are attacking your thyroid?
Yes.
So that makes you hypothyroid?
Eventually. Right. It can actually have some roller coasters. It can make you hyperthyroid sometimes. It can have variation, honestly. So, and if you've got something stimulating a glandular organ that's already predisposed to have nodules, it may get more nodules.
So you have a personal relationship with the thyroid
sure
gland.
that always influences us as physicians, doesn't it?
Tell me about Jules before we go to the thyroid.
So I have for years encouraged nurse practitioner students in my practice. I think anybody we're having to teach keeps us young, keeps us involved, keeps us looking at the answer. Why do you do it that way? How do you do it that way? How did you learn? So I've been involved with the School of Nursing for a long time and have practiced with a nurse practitioner before and enjoyed that over the years. But I didn't want to hire anyone, right? So Jules came as a student in January.
Convincing.
That's right. And honestly, within a few weeks, my staff and I were like, how can we keep her? She already has been through her own integrative health journey and well-read and this
Where did you go to
spirit.
school for a nurse practitioner?
UAB, so right
Okay.
down the street, yeah.
And how did you get interested in Dr. Miller's practice as opposed to, I really think you have a traditional practice with an integrative bent.
I think that's probably.
I think that's a better description. But how did you get interested in Dr. Miller's practice?
Initially, I was just looking for something, I'm from Atlanta originally, something that was more like some of the clinics that I had been to as a patient or shadowed before going into nurse practitioner school. So I was looking up integrative medicine. I think it was one of the first ones that came up. I looked and saw the great blend of medicine, the Western, and some integrative practices called up their office and just set up as a nurse practitioner student originally. Fell in love with your patients and your practice. Yeah.
Why did you become a nurse practitioner as opposed to a doctor?
Fair enough. Probably time. I think that was definitely something when I looked. And I was already a nurse, so that was kind of naturally the next step. Yeah, when I had decided that was going to be the next step.
And how are we doing here? We have anybody that has any pressing questions, or are we?
Not yet.
Okay. All right. Well, if you have questions and you're watching, this is for y'all. This is your show. Although I'll ask things that interest me. So I'm always checking my thyroid level because I'm always tired. I'm always tired, and it's always normal.
And what are you checking?
I don't remember. I check a TSH for sure. I probably check a T3, a T4. On the thing, it's thyroid function tests.
Fair enough.
So that's what I'm checking, and generally they're normal, but I'm always looking for something to explain
Well,
why
and we
I'm
may need to
fatigued.
look at adrenal fatigue. It would be very reasonable as a physician and, push, go, a
Right.
little coffee, right? A little
I
more stress
love
and
coffee.
Yeah, who doesn't?
I
You really,
love it.
but, so I think that's exactly why we often get our thyroid checked. We say we're tired. And maybe it's the cause, maybe it's not, but it's worth looking maybe a little deeper. So, we have reference ranges for our TSH, and, we're talking about what's going on in the brain, and at that point, the pituitary and hypothalamus are talking and saying, coming down here to tell the thyroid what to do.
Okay,
It's
so
more like
this
a
is
bowtie.
this is the brain, this is the neck.
Yes.
Brain,
I should have written that.
neck. Okay, that's fine. That's why I'm here.
So I often explain to my patients that this TSH is what is the brain asking for. So the higher it goes, the more it's asking for the thyroid to work. And so there are some acceptable ranges in Western medicine. They're about 0.5 to 5, although that varies from lab to lab. But truly, if you're at the high end of that range, your brain is saying, I need more. And then we look at T4 and T3. Mostly T4 comes out of the thyroid, but it does make a little T3, and so they're circulating T3 for two different reasons. But, our T4 has 4 iodines, that's why we call it T4. And then the body activates it, takes off an iodine to give it its activity. And so we're looking at, is this on the high or normal range? Is this on the high range? Is your body converting it? So is it taking off the iodine, and is it taking off the right iodine? Because it also can make reverse. And in Western medicine, there's debate on what the reverse can and cannot do. But it is generally thought that the sicker you are, or the more slow metabolism, whether you're in the ICU, that's where reverse really gets used in Western medicine, that your body makes more and more inactive thyroid. And I always think of this as like an isomer of Nexium, right? We think of Prilosec And then we took out the inactive component and we made Nexium. You're an asthmatic, that's what Xopenex is. They took albuterol and took out the inactive component, and now you've got Xopenex. So we know that that inactive component has a physiologic effect, and it gives you more side effects. So if the reverse, I also check the reverse. If the reverse is high or the ratio of the T3 and the reverse T3 in the blood isn't good, then we need to look at the thyroid in more detail.
So looking at this diagram, we've got the brain that tells the thyroid gland to make T4 and T3. T4 goes to the liver.
About 60% of the conversion into T3 happens in our liver.
So then it becomes the active T3 and the inactive reverse T3. Is that what you're saying?
Yes.
And then what about this T3?
Your
here?
tissues can absorb T3 or T4, and it can make peripherally it can make T3 as well. The tissues can. So it's kind of both directions here because the T4 goes into tissues as well, and some peripheral conversion does happen. It's just that the liver is responsible for about 60%.
And why do we think, why did I say fatigue? Why does fatigue make me think thyroid?
I know, because it's a huge reason for fatigue. I mean, a low thyroid does make you fatigued.
But why is that?
Because all of our physiologic, there's not a cell in your body, not a tissue in your body that doesn't need thyroid to work well. The heart does. You get arrhythmias. What's the first thing in med school, in your med rotations or your residency, if someone came in out of rhythm, you have to check a TSH because the thyroid controls the heart tissue. The thyroid controls your brain, the thyroid controls your skin. That's why when you look at the list of hypothyroid symptoms, it's massive.
It's huge.
It's massive. So
Gotcha.
it affects the GI tract, it affects everything. So, it's always nice when there's an easy fix, I guess, and it's the thyroid. But what I argue is that there's an art to making these ratios right and getting people out of their slump.
Right. And it seems to me that this whole concept of hormone balance
Yes,
is really an art.
it is. It really has to be between the provider and listening to their patient.
So where does Jules come in?
Yeah,
How did Jules learn this art?
Well, Jules is still working on the thyroid art. She brings the gut health really to my practice. So we both work on healing the gut, and there's amazing research right now, gut and brain connection. The flora, the health of our gut really affects how we feel, our anxiety.
We had a neurologist a month or two ago that was telling us that Parkinson's actually may start in the gut.
They're connecting it almost to every chronic disease. You can trace back to a change in the microbiome. So bacteria that they find that's different. So someone without disease versus someone with Parkinson's versus someone with depression. They can look and see that there's a different strain of bacteria that's prevalent.
Now you alluded to, Jules, that you had a personal sort of growing up experience with integrative type of medicine. Can you share any of that?
Sure, yeah. I got really sick towards the end of my undergraduate degree, mainly gastrointestinal disorders, some Raynaud's, so my fingertips were going numb, just kind of a gamut of autoimmune diseases, skin issues as well that really seemed to come out of nowhere. And I went to multiple different doctors, got, antibiotics thrown at me, it was H. pylori, it was this, it was that, it was Crohn's for a while, we really didn't know. And then I ended up with a doctor in Atlanta who practiced integrative medicine, and we just worked on my diet, and we worked on healing my gut and taking away things that were harming my stomach and adding nutrients, the building blocks to kind of clean
You
things
hear
up.
so much about gluten and gluten-free. Was that part of it?
It was temporarily. It was just removing things that were damaging the lining. So for the time, gluten is damaging pretty much to anyone. It's just whether or not we're symptomatic from it, whether or not our body can rebound from it. Gluten and dairy are two of the biggest things we think of when it comes to inflammatory issues. But we actually do some testing, so a blood test where we can find out what is producing just inflammation, not true food allergies, food intolerances, to see if we can't remove those temporarily and add some healing foods to let the stomach heal itself.
So Melanie, let's say somebody like Jules comes to see you with, let's say, a gut problem.
Yeah.
And as we mentioned with the thyroid, that the thyroid can affect all your organs. And so your workup would naturally include thyroid function tests, just for about anything that anybody would see. It's probably part of every standard workup that you do that then might get tailored to the gut.
Right.
And so what I'm interested in is, tell me about if somebody like Jules came to see you, you would have, let's say, a standard, listen, we're just going to look at this,
Yeah.
and then we're going to tailor it.
Right.
What's the standard for in your practice, and then how would you tailor it?
Right.
I think our viewers, especially those that are coming in later, would like to sort of hear how you go about that.
So I think a couple things. You're right. We would do lab work. We would look at thyroid. We'd look at a couple nutrients depending on what the symptoms are. We're going to draw vitamin D, particularly for gut. Vitamin D is lovely for healing up and closing gaps in the gut. So we might order other nutrients though that could be minerals like zinc and selenium. And copper, we would balance that with copper. And then the B6, B12, depending on what neurologic, maybe B1 and B2, and folate. Then also we might consider, depending on what other symptoms, some chronic infections. So there might be some chronic infections we look at. Not just mono, because I think when people are tired, they often think about mono, but we also look at chronic infections like Lyme. So that would be blood work. And then we would also add what she said was the IgG food intolerance test to give us an idea. And we run usually a panel of 96, but sometimes 184
foods that we're testing.
to test. Some of them overlap. Certain dairies test to make sure that if dairy is an issue. And that would give us an idea of what Joel said we need to remove to let the gut have time to heal. We can probably reintroduce them. It's not an indefinite never to eat. We would look at adrenals, and I do that through saliva cortisol. So you take home 4 samples and you collect your spit for me. It gives me an idea of the morning versus the afternoon. I also might do blood on sex hormones depending on where we are in life. So that might be included in that. We also might actually send off stool studies depending on how much the gut is screaming at us. So sometimes we'll look for basic inflammatory markers. Calprotectin comes to mind, which we all would use for an inflammatory bowel disease like Crohn's. But also we might look at what bacteria are there. Do they need to be balanced?
You know what would be a fun doc talk for me to do with you, Melanie? I'm going to think ahead. Would be for you to take a chart of a patient that you've treated, let's say over a period of time, let's say 3 months, 6 months, or a year, whatever, and somebody who came to see you with XYZ complaints.
Absolutely.
This is the test we ordered. These were the results we got. This is what we did. This is what happened. And this is how we reacted to it.
Sounds like a great PowerPoint.
You know what I'm saying? Just to sort of see, maybe even if you put it in a PowerPoint, that would be even an interesting flow. Because, everybody has a story.
Yes.
And what I'm trying to do is I'm trying to not lose my audience, but stimulate my audience to engage them. I think I'm going to leave it at that for now, unless there's any.
Yep, couple of questions.
All right, go ahead, Blake.
First, what's more common, hypothyroidism or hyperthyroidism?
Hypothyroidism by a long shot. So low thyroid would be much more prevalent. And I think that's for a couple reasons. One, our organs give out, right? As we age, they give out. They get stressed by our diet, by our lifestyle, by the toxins, which I mean, the pesticides we get in our food and the chemicals that we all choose to drink and the heavy metals that we get exposed to. So it's natural for the body to have less function over time.
Okay. What's your opinion on intermittent fasting?
There's some incredible research going on right now about intermittent fasting, and we promote mostly a 6 to 18 or an 8 to 16 intermittent fast. where patients fast for those 16 to 18 hours a day, and they eat in a window of 6 to 8. And we're working on other hormones.
Well, we say it again, I'm sorry.
Yeah, so you choose, for example, I'm a mother of 4, so I have 4 boys to come home and make dinner for. So I generally don't eat until noon, and I try to eat dinner by 6. And then I don't eat for the next 18 hours.
Interesting.
Yes.
Interesting.
You think, really there were studies all the way back to 2007 that showed this idea of eating 5 small meals a day really didn't allow the pancreas to rest. It didn't allow the hormones that we're just learning about to get off the hamster wheel. So with intermittent fasting, we're working on adiponectin and ghrelin and leptin resistance, and so we're seeing people feel better.
So this concept of 3 meals a day is really way off.
For some people, right? It doesn't always work for everybody. But
Okay.
yes.
Now, this is for weight loss. I mean, so this is the
For weight
idea.
loss as well, yeah. and you're
This would
taking
be
into
for health,
account-
though. I think you're really referring to this as health. And what about fasting, like for cancer?
Right. I certainly have a couple patients who do prolonged fasting, 3 to 10 days of water fasting, and they feel good. I'm not sure I'm up for it, but personally, but they feel really good, and they feel like they're doing their body good service.
I feel like that is being studied at UAB,
It should be.
looking at fasting and cancer. Anything else there?
That's it for now.
Okay, so
Thank
before we sign off, tell us Birmingham Integrative Health,
Yeah.
and I think we should have the concept now that integrative health is sort of a combination of traditional Western medicine and integrates,
Yes.
let's say, things that are less traditional.
I love that. That's exactly right. I am not willing to throw out what I learned. I think what I learned in med school has value.
And how do people find you?
Oh, it's just lovely. I'm a hugger.
I am too. How
On Facebook,
I'm so
Birmingham
sorry.
Integrative.
Question now. Oh,
You do
absolutely.
get free hugs at our clinic.
Absolutely. Sometimes. Couple. Yes, so we are on the web. We have a website and we are on Facebook. I'm just in Trustful, right downtown, next to Moe's and across from Edgar's.
Oh, yeah.
I certainly have patients who get their lab work done and then go have a treat at Edgar's after they see me
oh dear.
for 6 months.
Oh dear.
I will let them
Okay.
feel good. So.
All right. Well, thank you so much for coming
So
in.
easy.
So think about that. Think about
Yeah, I love
that
idea.
chart thing.
Great.
It'd be fun to go through, a patient like that.
Wonderful.
Jules, pleasure to meet you.
You too.
Thank you, Blake.
All right.